question. And it really depends on two things. One is, which knee are we operating on? And fortunately, most patients drive a automatic transition today, not a stick shift. But assuming that you're driving an automatic transmission and you've had your left knee operated on, you can drive whenever you're comfortable because the right knee is still okay. But if you've had your right knee operated on, most state DMVs recommend that you don't drive for 4 weeks afterwards because the reaction time is decreased a little. Getting your foot off the gas onto the brake is decreased a little. And if you had an accident, technically you could be considered responsible or at least implicated in the cause of the accident if it's your right knee and you're driving within 4 weeks. So we tell our patients to try and avoid driving.